You're listening to Counsel, a podcast I launched in 2018. On this show, we explore how lawyers can build satisfying and successful professional lives. There have been enormous changes in the practice of law in the decades since I became a member of the bar. On this show, I bring you conversations with attorneys who have charted interesting career paths as the profession has evolved. I'll speak with consultants who are helping the legal community navigate these changes. We dive into strategies, mindsets, and ideas that can help you grow your practice and grow in and out of our profession. And now, here's today's episode. Welcome back, everybody. Just a reminder that if you are listening to Counsel on one of the audio podcasting platforms like Spotify, you could also find us now on YouTube. If you're watching on YouTube, it's nice to have you here. Today, we're here to talk about health law advocates and careers in the public interest. Health Law Advocates is a Massachusetts-based public interest law firm dedicated exclusively to improving access to health care for the Commonwealth's most vulnerable residents. Many people go to law school wanting to do mission-driven work. I know I did. In this episode, we're talking to somebody who actually does that every day. My guest, Matt Selig, has spent nearly 2 decades with HLA, rising from staff attorney to executive director. His career offers a great window into how health access challenges have evolved in Massachusetts and what the landscape looks like today. We are going to discuss the challenges and rewards of a public interest legal career as well. Welcome to Counsel, Matt. Thanks so much for joining us.
Thanks, Steve. Thank you for having me on. Very happy to speak with you and to your listeners.
Let's begin by talking about your organization. How does Health Law Advocates improve healthcare access for Massachusetts residents?
So Health Law Advocates, or we're known as HLA, most people know us as HLA. As you said, we are a nonprofit public interest law firm, and our mission is to help people overcome access to healthcare by providing free legal services to income-eligible residents of Massachusetts. And we also have an additional mission of improving healthcare access generally in the community for people who are most at risk due to factors such as race, ethnicity, gender, immigration status, disability, and so forth. And we carry out our mission with 3 buckets of activities. And the main thing we do, vast majority of what we do, is provide free legal assistance to people who are having trouble accessing healthcare and need a lawyer to overcome those barriers. We also do outreach and trainings with community members to let them know about their rights in the healthcare system and how to advocate for themselves, or if you're a service provider, advocate for somebody else. And we also communicate with policymakers as well, and folks who work in the healthcare system who have policies within their institutions to try to impact those policies to improve access to healthcare. So those are our activities that we carry out. And then our organization has identified some particular priority areas that we focus on and use those activities to address. And I can say what those priorities are. Our largest program is our mental health advocacy program for kids, which helps, obviously, children overcome barriers to mental health services. We also have an immigrant healthcare access initiative, focusing on access for folks who are not United States citizens but live in our state. We also have a program focusing on helping people with medical debt. We have a program focused on helping transgender people and gender diverse populations access gender affirming care. And we have a program that focuses on helping people with disabilities make sure that they can access health care in their home or in their community so they're able to live independently in their community. And we also have work that generally seeks to defend people's rights in health insurance, both publicly subsidized health insurance like Medicaid and commercial health plans. I left out one program. We have a program also mental health related, but it's our mental health parity initiative. And that focuses on making sure that health plans provide benefits that are equal in terms of benefits covering physical healthcare, so to speak, and mental healthcare and substance abuse.
Wow, that's quite an exhaustive list. It sounds like the Ginsu knife set. Like, and that's not all. We'll also.
Right.
How many hundreds of lawyers work with your organization?
Well, don't have hundreds, but we have a really good sized staff and a terrific staff. So we have 40 staff people altogether, and we have about 25 lawyers on our team right now.
What are some of the more specific legal issues that might come up in some of the work that you do? Just give a few. You don't have to like get an exhaustive
Sure.
list.
Yeah, so our mental health advocacy program for kids work largely involves helping kids gain access to therapeutic supports in the schools by exercising their rights under special education laws. So we'll represent kids in that program, our mental health advocacy program for kids. And a child might be absent from school extensively because of a mental health issue. And what happens, and there's been some data on this discussed by state agencies, that what happens to a lot of those children is that because they're absent from school because of a mental illness, what happens is that they're, instead of providing them with supports for their mental health concerns, they are too often directed into the juvenile court system through a truancy case. So our work will be, in that type of case, our work would be around diverting them from the court system, which isn't really set up to help kids access mental health services, and try to get school systems and state agencies and maybe health plans to ensure that the child is receiving the healthcare services that they need, mental health services. So that's one area. I can mention another. I mentioned our program that supports immigrants. So there is a systemic issue that we have seen for years and years where immigrants, when they're trying to apply for public benefits, Medicaid, or insurance through our health insurance exchange, which is called the Health Connector in Massachusetts, that they are, in many instances, placed into coverage that has far fewer benefits than they're eligible for. And that's because the overlay between immigration policy and health benefits policy is very, very complicated. And so folks get placed wrongfully in coverage that is much less than they're eligible for. So we'll represent folks and demonstrate that how they are eligible for higher levels of coverage. And many of those clients that are in that situation are in a position where they need that better coverage for a pressing healthcare need. So people might be in a coverage that has very limited benefits and need an organ transplant. And that's why they've come to us, because their healthcare provider has said this person needs a liver transplant or a heart transplant, and their insurance won't cover it. They're on this minimal plan because there's a perception that they're undocumented. But we're able to demonstrate that they have a different status, a lawfully present status, and they'll be eligible for a higher level of coverage, and they'll be able to access a service like an organ transplant or cancer treatment or other services that are pressing needs for that person. So those are a couple examples. I could go on. One other, maybe I'll just say our disability program. Folks with complex healthcare needs and significant disabilities oftentimes enroll in Medicaid. Even if they have private insurance, they'll enroll in Medicaid to get coverage for long-term services and supports, which commercial health insurance doesn't typically cover. And we have a lot of folks who require services such as personal care attendant services or home health aides in order to live independently. And there are disputes sometimes with our Medicaid agency, which is called Mass Health in Massachusetts, over how many hours the person needs. So they may determine that a person with a disability needs 20 hours per week of personal care attendant services. They used to need 40, but now they say, oh, circumstances have changed, they need 20. But we'll represent clients and make sure that their services are restored if they are medically necessary. So that's a third example of the kind of work that we do within the projects I described.
How has the mission of HLA evolved since you first joined the organization?
So when I first got to Health Law Advocates in 2005, so I've been with the organization for 21 years, we didn't have a policy in Massachusetts that was designed to provide insurance coverage for everybody in the state. About a year after I got to HLA, our state passed that law, and it was designed to ensure everybody in the state had either insurance through their employer or publicly subsidized insurance, generally speaking. And so things changed right off the bat. There was this huge new law that our organization pivoted to helping people benefit from. And various other issues have come up over time that we've addressed. A significant new mental health parity law was something that came along in 2010. And we created a priority of making sure that big change in policy, that consumers had access to those benefits. And then very recently, we've had a situation where on the federal level, there's been another major policy change. The big, beautiful bill, so-called, passed on the federal level last year. And that is kind of the opposite of what happened in 2005. It's deconstructing policy for universal health care. And so now our work is shifting again largely speaking, towards protecting people from the impact of this new law. So oftentimes what happens is that there'll be a major change in public policy that changes one way or another what people are entitled to in terms of coverage or otherwise healthcare access. And we'll tailor our work towards helping our clients navigate those laws.
Let's shift gears here because a lot of people listening to this podcast are looking for inspiration for their own careers. So I think a good starting point is usually you telling us a little bit about your own journey. Why don't you walk us through quickly where you began and we know where you are today, but where you began?
Sure. I'll give you the kind of thumbnail sketch, but I will start back when I was in college, and toward the later part of college, I gained an appreciation for the political process and public policy. And so after college, I went to Washington and worked on Capitol Hill for 2 years for Senator Ted Kennedy on his committee staff. And there I got exposed to healthcare policy law, which was the most interesting part of that experience to me. And I saw that the folks working on that committee who were having an impact were lawyers. So I went to law school to have the same experience that they did. After that, I went back into public policy, worked in the Massachusetts State House for several years, significantly on issues relating to public policy. But I really wanted to be a lawyer representing clients who, and especially, delivering legal aid services. So I found an opportunity to come over to Health Law Advocates after working in the Massachusetts State House in 2005. And the opportunity at HLA really provided me the perfect opportunity because we do some, work that's related to policy improvements. But I also had the chance to have my own, panel of clients that I was helping navigate the system.
I want to hear a little bit more about your current role and how you evolved from doing the work to overseeing the whole organization. But first, can you say a little something about what it takes to be successful doing the work at HLA if somebody's thinking about, I'm interested in this kind of role?
Yeah. Well, you really have to believe in the mission. It has to be something that you're passionate about. I think that's really the driving force for people who are successful at our organization. You really have to believe that people have a right to access healthcare regardless of what your income or circumstances are. So I think that's really essential. And then I think, the basics, hard work, collegiality, ability to work with your clients, and also some stamina, because the whole reason why our organization exists is because fighting for healthcare access can be very difficult sometimes. And so you have to be persistent, you have to be, diplomatic and professional. You have to be compassionate and empathetic for your clients, and you have to be willing, to fight for your clients' rights while also looking for ways to also really work with other parties. Because I think in Massachusetts, we really do have a culture. This may not be universal, but I think we have a culture in Massachusetts where stakeholders in the healthcare system, whether you're a health plan, which are largely nonprofit in Massachusetts, or a hospital or other type of healthcare provider, or the government, they really buy into the ethic of helping people access healthcare. So in many instances, folks, given the right information, given the appropriate argument, they are willing to do the right thing to help somebody get access to healthcare. But there's a lot of pressures on different people in the different parts of the healthcare system that make that difficult sometimes. So, a mix of really persistence, but also, looking for solutions with even somebody who might be adverse to you.
What kinds of skills and experiences do you look for when you're making a hire for your organization?
Hmm. Well, we love to see if we're hiring a more experienced attorney, we really like to see people who've worked in legal aid before, who've have some exposure to the healthcare system, know the language, know their way around the different parts of the healthcare system, the role of insurance, the role of government, the role of healthcare providers. So we definitely prioritize folks who have, several years of legal aid or other public interest experience, although we'll definitely consider folks who are coming from the private sector. If their experience we think will help them transition to a public interest career 100%. And then if we're hiring a more junior attorney, we're looking for really strong internships, clerkships during law school, maybe even a clerkship with us. We have a terrific internship program that we encourage folks to apply to. So definitely experience. Those types of experiences are important to us. That are giving people, they're not going to come in fresh and not have any exposure to the healthcare system or legal aid type work, public interest work.
What about lawyers who are in private practice,
Mm-hmm.
like many of the lawyers that I talk to, who
Yeah.
are feeling a little bit burnt out from representing corporate clients, and yet maybe they've done some pro bono work? What do you think somebody could do to prepare themselves for a transition into an organization like yours or a firm like yours?
Well, when you started to talk about folks who are in private practice, I was started to think about somebody in that position we would still consider them, a good candidate to come work at HLA if they had a pretty active, pro bono practice and, showed a level of experience and, interest in that kind of work. So I think that somebody who's in private practice and they're thinking, maybe in terms of a year or two down the road where they might want to be, I would try to build up your pro bono practice and take as many cases as you can, look for an opportunity to serve on a board of directors, make a contribution to groups because, we, depend on those contributions, attend events, go to bar association, mixers, meet people, talk to people 100%. So those, transitions are definitely possible. We have had folks coming from private sector experiences. And it's great to see, if somebody has taken some steps to prepare themselves to make that transition, like doing some pro bono work and familiarizing self with the public interest community.
Speaking of dollars, where does your funding come from?
So about $5.5 million budget this year. Our largest source of funding comes through the state budget, and it largely funds our mental health advocacy program for kids, and we're very grateful to the Commonwealth for supporting that work. We also raise about $1 million in grants from foundations and other philanthropic organizations. We have about 800,000 or so from individual and corporate contributions through a big event we have every year. And we also have about $300,000 in contracts with some healthcare provider organizations that we work with to help their patients and members get access to healthcare and overcome barriers to insurance coverage and other barriers to care. So those are our biggest areas of income.
Short of taking a full-time job in some kind of a public interest law firm, how can lawyers get involved in HLA's work?
So since our very beginning, we've had a pro bono legal network, which allows folks in the community, lawyers in the community, to sign up and be available to accept case referrals from us. So we have about 150 lawyers who are on that panel now, and some are more active than others, but they all receive an email from us every 2 weeks. And they have a listing of cases that are available for referral with a description. And they can let the manager of our legal network know they're interested in taking a case. And we make the process very easy. First of all, we identify clients that we think would work well with a volunteer attorney. They're communicative. They have a case that's navigable, an interesting case, but, not overwhelming. If that's not what somebody's looking for. And we also provide support from a staff attorney at HLA to mentor somebody who's taking on a pro bono case. So we absolutely love to have lawyers in private practice work with us, take cases, because we need the help very much. We have a waiting list for services. So if folks aren't helped by a staff attorney or a volunteer lawyer, they are likely going to end up on our waiting list and have to wait, longer than we would like to be able to get a lawyer to help them. And that's not a good situation, especially if the help you need is to get access to a healthcare service.
For lawyers that are coming from the private sector, what do they need to know about working for your organization or just in general, working in the public interest?
Well, I think they need to know that it's really, really rewarding. And the work is of course challenging, can be frustrating at times. Almost any kind of work, I think, is, but the work really is very rewarding. And the successes you have are very concrete, and you're working with folks and get a lot of results where the person has come to you in a really, really difficult circumstance, and the situation ends up where you've really helped somebody be able to live a much better life because they're able to access the health care that they need. So I would say, if you see a public interest job, and I think probably more often than not, you're going to see a salary range that is lower than most private sector jobs, um, maybe by a little, maybe by more than a little. But I think that, job satisfaction and the sense of really helping somebody, in a very vulnerable situation is really rewarding. And we also have a great team. People are in it because they appreciate the mission and they are very collaborative. I mean, speaking my organization in particular, and I know many other legal organizations that we work with, they're great places to work, and folks work really hard and support each other in ways that ease the kind of hardships that you would expect. That it can be hard work, that you're, you know, experiencing people with very difficult situations. So there's kind of some transference of those difficulties on top of whatever, you yourself might have going on. But it really is very rewarding. And I think that if you can make it work from a salary point of view, I would 100%, recommend, this field.
Can you say just a little bit more about secondary trauma? Is there anything that your
Mm.
organization does as an organization to address some of the difficult situations that your lawyers are experiencing?
Yeah, so that's real for sure. And there are cases where people that we're representing, have been through abusive situations, immigrants who are facing, a lot of oppression in the community from immigration enforcement, all sorts of different ways that folks are having their own trauma that can impact folks when they're working with them. And so there is a state actually run service called Lawyers Concern for Lawyers, and it's a program that provides group discussions, facilitators for group discussions and even individual discussions. And they're a fantastic organization. And our legal teams have regular meetings set up with Lawyers Concerned for Lawyers. And it's really invaluable. They get to, share experiences that they have, discuss, coping strategies. So that's a wonderful service that we take advantage of. And we try to, focus on employee wellness, in other ways, just, generally speaking. But, that Lawyers Concern for Lawyers is the main way we work with that. And then, supporting our staff with, generous leave time and, and that kind of thing to make sure people, can get away and disconnect from the office for, hopefully as much time as they need.
I'll just add that in Massachusetts, Lawyers Concern for Lawyers is what will be called, or what would be called around the country, a lawyer's assistance program. And I think pretty much in every jurisdiction, there is a lawyer's assistance program that provides free and confidential counseling to
Mhm.
members of the legal community. Actually, it's not just lawyers, but I think a lot of lawyers are the ones who take part in it. LCL in Massachusetts is a terrific organization. I know the people that work there. I've spoken. It's just a great organization. So
Absolutely.
if you're just an individual who's experiencing some of these psychological issues, anxiety, depression, ADHD, there are people in your state who can at least be an initial point of contact to help you start to address some of those issues. Matt, we're getting close to the end, but I did want to hear a little bit more about how you transitioned into the executive director role, and
Yeah.
anything or any advice you might have for somebody who is thinking about not necessarily a strictly legal role in a nonprofit. So what can you say about what you do, how you got to where you
Mhm.
are, and
Sure.
what people might want to be thinking about?
Okay, yeah, absolutely. So when I came to Health Law Advocates, I had never represented a client before except for through an internship at the public defender's office during college. So I was lucky to have a chance to come into HLA. I'd had work experience and I'd been through law school and I'd had a lot of public policy experience and helped people with constituent services. But I came in as a staff attorney. And we were a really small organization when I came to HLA. So we had 5.5 staff people. So we had an executive director and 3 staff attorneys, and then 2 non-legal staff. So I started off as, an entry-level attorney. And then within a couple of years, a new executive director came in and we had a little bit of growth. And let's say we had 6 or 7 staff people at the time. And I knew I wasn't experienced enough to take on the role of executive director when we had that first transition about 2 years into the organization. Although I think I had gained some important experiences. I had started to supervise another lawyer that was even junior to me. I had done a little bit of fundraising and so forth, but I really wasn't ready to be the executive director when we had a transition. The organization grew, like I said, to about 7 or 8 staff people. And then there was another executive director transition when I had been at the organization for about 4.5, 5 years. And so at that point, well, the second executive director had asked me to become the deputy director. So she worked with me to introduce me a little to the budgeting of the organization and some additional parts of the management of the organization and kind of overall strategy. So that was a growth experience for me that I was very grateful to have from our second executive director, who was Barbara Anthony. And then when she decided that she was going to move to the Deval Patrick administration, I did apply to be the executive director and was hired for the job. So, if HLA had 40 staff people at the time, I don't know if I would have been a great candidate, but, I had been a leader in an organization that was 6 or 7 people, big. And so they gave me a chance, and I really appreciated that they did give me a chance. I think being somebody who had been a part of the organization and had helped it grow, made me a good candidate for the job. And I have had the chance to work with our team to really grow the organization, really by, 2 things, showing that we do great work and earning the confidence of, people that can support us, that can invest in us, whether it's the state or philanthropy or individuals or businesses. So we've worked really hard to provide excellent services that people want to invest in. And I think it's fair to say that I've learned on the job. I've had, some, professional development experience, but a lot of it has been working on the job. Our board of directors has been incredibly, incredibly supportive. All of our board chairs who I work with closely help me navigate things. I've always had a great CFO. Other senior lawyers have helped me in so many ways. So in my new role, my role is more overall strategy. I do a lot of fundraising. I work with our legal team directors to kind of identify the goals for their teams and the issues that they want their lawyers to focus on, and do a lot of external, kind of communications with other people to let them know what HLA is doing and keep the community informed and outreach to potential clients. And so my role has shifted, but I am in conversations with on individual client matters. And I've continued to handle a couple of individual cases over the years. I don't have my own whole caseload, but my role has changed. And yeah, I love it. I'm very lucky to be part of Health Law Advocates and have a chance to be a leader in the organization. It's a great mission. Our supporters are fantastic. So now I'm just, talking about all the good stuff. But that was my path, really, from a junior member of a very small organization. Because it was really small, had a chance to take a leadership role, probably, before I would have been able to take a leadership role in a larger organization. I think I've had success in the job because, our organization has grown. I think I know we deliver terrific legal services to our clients, and I think we have a good reputation in the community. So I'm really proud of what we've been able to accomplish. And it's fun to build something. Not only do I think we have a really strong mission, but it's fun to build a program and to see how much more impact that you can have every single day, every single month, every single year.
And it's such an important mission. What is the single best piece of advice you'd give someone seriously considering a public interest career?
So we covered some of it. It depends where you are. I know your audience is mostly lawyers who are, experienced attorneys, I think. So become involved, volunteer. Practically every legal organization has an opportunity to do volunteer work representing somebody or providing research or something. Reach out, get involved, and, see if the work is interesting to you. There's so many different issue areas to tap into, whether it's housing or immigration law or healthcare access or domestic violence. There's so many different areas to choose from. And, every area has legal aid organizations, I think, and I think they all accept volunteers. And so that's definitely one thing. If you're and that would go for somebody who's, a first year attorney at a law firm or a solo practice, if you can squeeze it in. And if you're a law student, obviously apply for internships, apply to volunteer for organizations during the semester, and just introduce yourself. If organizations have events or trainings, go and meet people and get yourself out there. Introduce yourself to these groups where organizations that, we're looking for chances to interact with people in the community, because we need all the help we can get. So yeah, get out there and learn about the work that folks are doing, and find the group that really inspires you to get involved and, work for the community.
Great advice. Last question that I ask all my guests: what's one podcast, streaming series, or book that you'd recommend? And this is purely for enjoyment.
Oh, good. I'm glad. So yeah, okay. So purely for enjoyment, 100%. So I do listen to some podcasts. I, mostly just for enjoyment or fun. So I'm a huge sports fan. So I love the Bill Simmons podcast. He's a lot of what he taught. He's a huge Boston sports fan. So he's about my same age. So I kind of relate to, his conversations a little bit. So the Bill Simmons podcast, outstanding sports series. And he puts up a lot of content. He puts up probably 4 podcasts a week. So by the time, I finished one, I'm on to the next. So that's actually, I think, a really good reason to listen to it, because you're not starving for content.
Matt, this has been a great conversation. Thanks so much for joining us. You're doing such important work. If anyone in our audience has follow-up questions, how can they reach you?
Email me at Selig, Selig, at HLA-inc.org.
I hope you enjoyed this episode. If you did, please tell others and rate us on iTunes, your favorite podcast app, or like us on YouTube. If you'd like to continue the conversation, I welcome your inquiries and invite you to set up a time to speak with me about your own career or marketing concerns. I've been coaching lawyers for over 25 years, and I'm happy to do a free 30-minute consultation. You could sign up on my website at Seckler.com. That's Seckler.com. On my website, you could also find links to more episodes of Counsel to Counsel and get access to many free career marketing and leadership resources. In the meantime, thanks for listening.